Hi, we've talked over the past few weeks about the crises in healthcare, both the costs and availability of providers. We've not said much, though, about another branch of medicine, one of the specialties, which is dental care. So I'm Annette from Nothing Without Us, Stories and Discussions of Meaningful Inclusion. If you like what I'm doing here, please help me stay on the air. Um, you can subscribe if you haven't already. Tell your friends to subscribe. You can also, please leave me a comment, a like. All of this helps. So today I do have a very special guest that can talk with us about what's going on in Rhode Island about dental care. Okay. So today I have the opportunity and the honor of having as my guest Dr. Andrew Gazerro, who is president of the Rhode Island Dental Association. Good afternoon, Dr. Gazerro. How are you?
Good afternoon. Good. Thank you for having me.
So, we're talking today about the cost, how, doctors and dentists are being pushed out of Rhode Island through costs because they're not getting paid the reimbursements that other states are being paid, and the costs aren't lower just because we're in Rhode Island. Am I summing that up pretty well at this point? Okay.
Yes, absolutely. While we understand that socioeconomically states are different, Massachusetts is not Rhode Island and Connecticut is not Rhode Island, and vice versa. Uh, However, what we do as physicians and as dentists is no different because of the state that you're domiciled in. And our costs as far as supplies and infrastructure is the same. And in other aspects, insurance for an office, electricity, overhead are all different. And to be reimbursed less for the same procedure just because of a zip code really doesn't work. And what's happened over time is our costs have increased and increased, but the levels of reimbursement have remained stagnant, and therefore we're not making what we were in the past on a dollar per dollar basis in order to continue to work and advance. We basically have to continuously find ways to operate leaner and leaner each time.
So there's no Rhode Island discount for all your supplies and equipment.
No, you're when you purchase something from a supplier, you're paying the same price per item as everyone else. That in the past you used to have some negotiating power with the suppliers. That's gone away. I mean, they will, to some extent, depending on your relationship, maybe work with you for shipping, but majority of them, it's just continuously pass their costs on to us, so that they don't operate at any type of a loss.
Right. Yeah. So you're kind of caught between a rock and a hard place. Um,
Mhm.
so let's talk a little bit about the value of dental care as a medical specialty, as an important part of people's health. And let's see, let's let people know how important that is. Mm.
Yeah, and I'm glad you mentioned it that way because that's how I and many of my colleagues view dentistry. It's not that we're a separate entity any longer. We are a medical specialty. We just happen to treat the the mouth and the neck and head region of the body. That's how it is. I mean, we treat living structures. We don't just drill holes in teeth. A tooth is a living structure. It has a blood supply. It has a nerve supply. Uh, and we've we've found as time has gone on that many of the things that happen in the mouth impact the rest of the body. So now, when an individual needs to have a heart valve replaced, they need dental clearance before they can have the heart valve replaced. Uh, It's important for patients who have diabetes to maintain good oral hygiene and have routine oral care done. They're linking things to Alzheimer's disease and oral health. So there's a myriad of aspects that come down to the how dental care impacts an individual's ability to stay healthy. Patients constantly, doctors will tell them, well, you need to lose weight. Well, how can you lose weight if you can't eat foods because you don't have teeth to chew? So that's the simplest analogy is you can't maintain a proper diet if you don't have the ability to function any longer. So there really is this push to get us back into medicine, whereas in the past we've tried to stay as far away from medicine as possible.
Right, right, but it is true. I think I told you, I remember reading articles in the past about how routine dental care in adults can help prevent, cardiovascular diseases, which we know are really a big deal these days. So,
Yeah, the new mantra from the ADA is oral health is health.
yeah,
You can't be truly healthy unless you have oral health.
right. So is it the insurers or is it the state? Or let's talk about where the problem lies.
So a lot of the problem lies with the private insurers, which have not kept pace over the past 2 decades with the reimbursement levels that we've received. And that in hand has translated into the state side because our margins are so small on the private side of business that we can't afford to just give away our care to the less fortunate who are on the state programs. In the past, when our margins were higher, we we didn't mind donating our time and our services because we looked at it as pure philanthropic and opportunity to help and give back to the community. But now when we're finding it so difficult to make ends meet on the private side, we can no longer give away our services to the public. So it's had a great impact on that population to the point where no or very limited number of the dentists who practice in Rhode Island participate on the state programs, which has created backlogs in the FQHCs and health centers who do participate with those programs to be able to see patients because they have to take care of 1/3 of the Rhode Island population, and that just can't be done. So what we've been trying to do is get improvement on the private side because what they've shown in other states that as the private insurers started to increase their reimbursements, uh, there was a subsequent increase in number of dentists who participated in the state programs because now you can offset the loss or the cost of providing those services, which we don't do them to make a profit. We know that there isn't a profit. It's really just to give back to the community. Uh, but when you're almost at a loss on the private side, you can't do that any longer.
No, I can understand where you're coming from, and I know, like, from people with disabilities, they're saying how hard it is to find a dentist that can meet their needs, and even in the health centers, the waiting list can be pretty long. Um,
Yeah,
so,
we've shown the biggest problem is with the children right now.
mhm,
That we've identified in the Providence school system alone that there's close to 500 children who need care that has to be done in an operating room setting. And the backlog for those cases right now to just get one individual in is anywhere from 6 to 8 months.
wow,
And we've extrapolated the data out. And if we were capable of doing 5 cases per day, 5 days a week, it would take us about 4 to 5 years to get through the entire state backlog of cases that
Mm.
we've basically figured that there are.
Yeah, that's pretty bad. That's really pretty bad. Um, Now, we do have a state insurance commissioner. Is there anything that has gone on with that to help?
Yes, so we've been working directly with Corey King, who is our health insurance commissioner. Last year, the Rhode Island Dental Association proposed a bill that would look at what is called a dental loss ratio, or how much of every dollar taken in by premium is actually spent on care. The bill passed successfully after careful negotiations with both the dental association and the private insurers,
Right.
to create, and I hate to say it, it's because it isn't just a study, but we needed to gather all the data to
Right.
see the actual um, where they actually are in terms of spending currently. Um, the first 2 years of data have been submitted. The insurance commissioner has, the health actuary has been hired by the insurance companies who pay for that. And they're starting to sift through the data.
Mhm.
And the way that the bill was written is, the insurance commissioner needs to report his findings on and before 2026. Well, we worded it specifically that way because, if after he goes through this first set of data, if he feels that there's sufficient information, he can stop.
Yeah.
Um, but the nice thing is that we have a good relationship working with him. Uh, he's hearing our issues and doing what he can, because the office is mainly a consumer protection agent, but he sees the need for a provider protection agent as well.
Well, if you can protect the service, then it is consumer protection. I
Hmm.
think that this is a big problem all through Rhode Island is, making sure that consumers can get the care they need. Um, and that is definitely a problem in a lot of areas of medicine. And as you well know, so, I think this is a good way to approach it if you've got the cooperation there. And you had the legislation passed, so that means you have some connection in the legislature. I think it is worthwhile also, be kind of public, you know, um, PSA ads now and again. Um, let people know that this is going on, and let other people know that we have to fight for this. I know right now we're kind of battle weary because so much is happening, but it does have to be it is the way to get things done. You can get people to um, write to their, state representatives. Um, you know, that's one of the things I think I see going on. I'm not sure. Well, they can push that, in order to do business in the state, insurers have to, comply. If they're not, once they present this data, they can pass that law. And that should make a big difference, because if an insurer loses the part that covers dental, they'll lose clients, customers altogether. So,
Yeah,
you know,
we're constantly advocating for our patients. Last year during the campaign, when we were at the State House, we did have public service announcement messages out on radio. We had public service announcements out on television, and
right.
every dentist had the bill advertisement posted in the office. We had numerous conversations with our patients to make them aware of what was taking place.
Mm.
We have another bill that's at the State House this year. It's also a patient-centered bill. that would allow them to use benefits at any provider that they choose and not lose any of their benefits, so they could see an in-network or out-of-network provider.
Okay,
Uh,
that's, yeah.
we've had patients write letters so far on the House side. We have the hearing for the Senate next week.
Okay.
And it would be a great follow up to last year's bill, because this increases access, that you can't be shut out of any provider and have any of your benefits removed. You would still receive, so patients have the choice to decide who they want to see, where they want to spend their money, where they want to use their benefits, and not be held to any type of a network or network requirements.
Yep, sounds good. Do you happen to know the bill number offhand?
So it's H6155 on the House, and it's
Okay,
S905 on the Senate.
okay, good. And they are coming up for hearing shortly.
Yeah, we had our House hearing is
Okay,
complete, and it should be heard on the Senate side. Believe the 20th is the scheduled date. It's, obviously the Senate's behind because of the
that's
passing
it,
of the president
right.
of the
Mm,
Senate, but as they gear back up, uh, we're hoping to get a hearing to go. So, our argument is that these benefits belong to the patients, and the patients should have the right to decide where they want to use their benefits. They should not be excluded or penalized for seeing a dentist of their choice.
right,
And that's really you know, hopefully that helps get access. They shouldn't be excluded,
right, yeah,
our argument.
yeah, right, yeah. But it will also be important, no matter what dentist you see, that the insurers, kind of step up here. I'm finding that insurers in a lot of areas are, really, not as fair as they used to be. So,
Hmm.
you
Well,
know,
the big issue comes down to network adequacy, and when you have an insurer that has a 95% market share of dentists in the state, what that tells them is that we're happy receiving what we receive as payment. So there's no benefit for them to
right,
want to increase anything. Uh, but we're forbidden from negotiating with them, and we're forbidden from getting together and say, hey, let's make this decision to, in a mass exodus, get uh, to leave their network. We can't do that. It all has to be done individually. Um, and until you're educated enough as an individual to see how it's impacting your own personal business and make your own choice, you're not going to have this at a 95% market. You're not going to have this decrease in uh, market adequacy for these plans. So there's no incentive for them to increase the rate, because there's so many of us that are accepting the rate. The goal typically is, as long as they have about an 80% market share in a region, then they're adequate. Their network is adequate at that point. Anything above and beyond that is extra. And we have about 95% of the dentists participate in either one or both of the two major dental plans in the state.
right. So if patients though, say, well, I want to go out of network and they start going, that can, take a hit on their market share. And that does put a pressure.
It yeah, it can, but what they do is, currently, and that's what the bill is trying to change this year.
Mm,
If a patient currently sees an out-of-network dentist, then their benefits get reduced, which increases the patient out of pocket. And our argument is that, why should the patient be penalized for making a choice as to what they want best for them? Um, they typically, that's one of the things last year during the hearings. Um, representatives from Delta Dental, who is the largest dental insurer in the state, during their testimony, never once said the word patient. It was
Mm,
all our accounts. Everything was accounts, employers, but never once mentioned patient.
right,
And that becomes our argument this year is you can't penalize a dentist who's out of network because they're not under your contract. So instead you're hurting the patient by making it more difficult for them to access the care that they want.
right. But that is part of what's going on in healthcare overall. The
Oh,
provider
yes.
and the patient are separated by a great deal of red tape so that they don't even get to communicate on decision making and things. You know, the insurance says this is what you can have. So this is, I think it's a good way to fight it. And I think it's a good model that I, would recommend they look at it in a longer, on a broader spectrum as well, looking at it in healthcare in general. Because again, I get a kick out of the whole thing when people, when you start talking about a single pair, well, you don't have choices, that way. And I'm there like, you don't have choices now. You can say, well, I'll have this insurer. Now I'll get this and this, but I'm going to lose this and this. And then you do, in the same thing, you go to another one. Well, okay, I get those, they cut back on this, so you end up going through this with every insurance, scenario now in all of healthcare. And so you've disempowered both the provider and the patient. And
I always say the simplest way for it to work would be that the, the the provider charges X, the insurance pays Y, and the patient owes C would be the best approach. Uh, because then there's
mm,
going to be providers that are going to do it at the insurance cost, and there's going to be some that are greater. But
mm,
then that leaves it up to the patient to decide. It, this is where I either I want to go and I'm going to pay the difference, or I need to go where I can afford to go. And it creates a free market so that only the doctor and the patient are the ones that are making the decision.
right,
And as long as it's been a procedure's been done and it's been done correctly, then the insurance carrier just pays its rate and we're
right.
finished at that point.
Well, except that the patients don't always know where that's going to fall.
Hmm.
Because the various insurers have different ways and they're not comparable. You
Yeah,
don't, you
yeah.
can't look at two different plans and know which one's going to cost you more or less or be better for you because how they put it out.
Hmm.
Uh,
Yeah.
so
We have the same issue because there are companies that have what are called same branded companies, but they're out of other states.
yeah,
And the problem is that even though you're a part of the national network, you don't have access to the fee tables. So
right,
when those patients come in, you don't know what, if any, co-payment they're going to have.
right,
And part of it is because the insurers don't want us to see what their payment is going to be uh, because it's different than what they pay within that same state. So let's take
right,
Massachusetts for an example. They don't want me to know that they pay an individual in Massachusetts 30 to 40% more because when they pay me here in Rhode Island, they don't pay me that same amount. They pay me less. They pay at what we call an interstate rate. So
mhm,
they don't want me to know that they're paying more in each state, even though
mm,
they're not adjusting the premiums for the patients who cross the border for whatever reason. So
yeah, right,
uh, it's very deceptive on
right.
behalf of how things work. So,
because Rhode Island, now this is something we shouldn't be doing, but I think, well, Rhode Island's so small, so just set up all your practices right outside the border and, yeah.
Yeah, well,
Uh,
there was a big push. There was a big push several years ago, and several providers. I can give you the example. It's Newport Avenue in Pawtucket, which
oh, I
borders
grew up there.
Attleboro.
I grew
Um,
up there in that area.
so most of the dentists who are on the border moved their practice a quarter of a mile
Hmm.
into Attleboro
Right,
to get the increased reimbursement rates. And they
right,
didn't lose patience because, well, what's another two traffic lights?
right. Well, except Rhode Island, that is a problem, but,
Yeah, I know. Yeah.
so,
So,
you know, but I do think, by working with the insurance commissioner, he's gonna do it on data, and it's about time the data comes out.
yeah,
That people can see, what they're doing, and we can put it in, shed a light on it. This is what's happening, and this is why, and how are we going to address it? And I do think that is well, probably because I'm an economist, I think that's a good approach. When you take
mhm,
the data, um, it's hard to argue with it.
yeah. He was very receptive. We
Mm,
gave him, or I gave him data that went back to 2002, comparing the rates of
mm,
reimbursement for the average procedures that we perform on a routine basis and
mm,
compare them to what we're being reimbursed today. And on a dollar per dollar basis, we're being reimbursed less than we were back then.
right. That's
Some things never haven't changed in over 20 years. We're not getting not even a
right.
dollar more. And some things that have changed haven't changed enough, because when you adjust the numbers for inflation,
Right.
you're actually reimbursed less than you were 20 years ago. And
Yeah.
it's not, that's not sustainable. And then there's no incentive for us to modernize either at that
Mm,
point, because why am I going to spend money on new technology that's going to cost me money to purchase the equipment?
mm-hmm.
Uh, yes, it might make me more efficient, but I still have to pay for the equipment on top of what I'm doing with it. And it
Right.
does so it's that's the other aspect that it's having an impact on, is we're not getting into the new technologies unless you make that leap to
Right.
want to do it, because there's no incentive to do it. Uh,
Yeah. Right. No, no, I get it. I get it. And I do hope that this helps, people see and become more involved. I do know that, because I'm also an activist, so I'm a believer in people getting involved. Um, so that, one, the good use of data. I'm glad you're looking at that. I mean, I used that when I was, fighting with the legislature about the rates they were paying PCAs, because they didn't give them a raise for like 18, 19 years. All of a sudden, we had no more PCAs. They didn't raise it enough, so I'm concerned. But, I could show on the Bureau of Labor Statistics, you can just look it up. This much money in 2020, this is what it would buy in 2025, and or this is how much you need to buy the same thing in 2025, and there is a significant gap. So so having the data and being able to plug it into like I said, the Bureau of Labor Statistics has a calculator online that you can use for this. Um, that data really makes a difference. And then letting people know. And like I said, I'm an activist. I've worked with a whole bunch of activists at this point in time, because we know that that's the only way we're going to get any change. And so, doing that is a good approach as well. So I'm going to ask you to, I'm going to remind people in the podcast to look for those bills. to write to their representatives. And then at the same time, let me know how, when they start, making the decisions based on the data, and let's revisit this. Let's keep at it and make some noise. If you're okay with that,
Absolutely.
you like making
I
noise?
am, the noisier, the better.
Okay. All right. Well, I thank you very much, and I look forward to a future conversation.
Absolutely. Thank you. I appreciate the forum. Have a great day.
You too. Thank you for listening. I'm Annette Bourbonniere from Nothing Without Us. I hope you found this discussion with Dr. Gazerro as interesting as I did. I am going to post in the notes the bill, well, actually links to the bills that he discussed. I encourage everybody to write to their state representative about these issues so that we don't lose all dental care in Rhode Island. I think it is a risk, and we should be worried about it. So if you like this episode, please leave some comments. Please drop me a like. Tell your friends. They can find us on patreon.com/nothingwithoutus. You can also find this podcast on YouTube, Spotify, and you can find me on LinkedIn and Blue Sky. So until the next Nothing Without Us, I'm Annette.